From CBS News, this is the Saturday Early Show, coming to you from Fifth Avenue in New York City.
After a lengthy review, the Food and Drug Administration last night lifted a 14-year voluntary ban on silicone gel breast implants. Two California companies, Allergan and Mentor, won approval to sell the implants in spite of the long debate over their safety. Joining us this morning is Dr. Scot Glasberg, a plastic surgeon here in New York, who's testified on the subject before congressional committees and FDA panels. Good morning, Dr. Glasberg.
Good morning, Tracy.
So why did the FDA lift the ban?
Well, science has finally won the day, and my patients are the real winners today. Women now have the opportunity to choose between two medical devices. It's been a long time coming. The science and all the studies have shown now that these are safe and effective devices.
When you say they're safe and effective, you mean the science has shown. A lot of women said that these led to disease, that these implants made them sick.
Right. As a physician, I empathize with those women, but what the studies have clearly shown that there's absolutely no link between silicone and any disease processes. And the science has allowed women to have the opportunity to choose.
And you say they choose silicone over saline. Why is that? What's the difference?
Well, if you simply look at the implants and feel them, the look and feel is much more natural. The contour, shape, and texture all more naturally mimic what a woman's breast feels and looks like.
The silicone implant does. And you have an example of them here.
Right.
This is
a silicone implant, and this is a saline implant. Even just by touching it, just superficially, you can feel the real difference.
That the silicone feels more real.
Right.
Now, obviously, one of the big concerns here is that they leak.
Right. Well, as with any biomedical device, there's a failure rate. But what we've shown through the studies and through the science is that these are safe and effective, and that the rupture rate and the failure rate is very low.
And these silicone implants are different than the silicone implants of old? They're less likely to leak, less likely to rupture?
Both are true. And we're in another generation, a third generation of implants. The gel in the implants are actually more cohesive.
Can you show us? Can you cut one of them open?
Sure. This is a gel implant. Even tough to cut because the gel is tight.
Okay, so when it
But you can see that, you could squeeze it, it looks like the gel will come out, but if I let go,
it goes back.
It goes right back into the shell.
So are you...
And if I were to leave it here, I'm sorry, leave it here on the table, the gel really doesn't go anywhere.
Mm-hmm. As a doctor, the FDA is calling these reasonably safe. Do you feel 100% comfortable putting these in your patients?
I would take that even a step further. If a family member of mine wanted a breast implant, I would actually recommend to them getting silicone gel, simply because for certain women it just feels and looks that much more natural. And even our patient satisfaction studies, which were part of this data, have shown that women are very satisfied and happy with silicone implants. So the answer is absolutely. I'd recommend it not only to my patients, but even to my family members. Critics
say that there's still a concern because there haven't been long-term studies.
The reality is that this is the single most researched device in the history of the FDA. I feel very confident, scientists feel very confident, and the patients who've had them feel very happy with the devices. So I'm confident sitting here saying that these are safe and effective devices without any issue whatsoever.
Now, the FDA has said that saline, 18 and up, women 18 and up can have saline, but for silicone, you have to be 22 years old or older.
Right. I think, we've typically used 18 as the guideline. The FDA decided on 22 as the number, and we respect them. They went through a very thorough and vigorous process to come up with the data and to come up with these guidelines, and the surgeons will follow it.
And they say that's when your breast tissue is fully developed, and that's the reason that they chose an older age for that.
Absolutely. I think that, 18, 22, I think this will work well for patients overall.
Briefly, do you think that this is going to end what has been a very passionate debate?
I think passion is really what it is, and people feel strongly on both sides of the issue. But at the end of the day, science has won the day. So, we may still hear more about some of the debate going on, but the science, you can't argue with the science. You can't fake the science. The science is real data. And what we have here is real data that supports the fact that these are safe and effective devices. And I and many are very comfortable with that.
All right, Dr. Glasberg, thanks so much. Of course, the companies are obligated to continue to study this over the next few decades to see how this turns out.
We're all committed as surgeons and as a society to continuing to study the devices.
All right, thanks so much.
Thank you very much.
And for more health news, you can go to our partner in health coverage, WebMD.com. Now here's Russ.
Okay, Tracy.